Good afternoon, everybody. I trust you're all safe and well. My name is Andy Bywater, and I'd like to welcome you all to this knowledge sharing event hosted by Syngenta together with Goodbye Malaria. The theme of today's event is Rethinking IRS in Times of COVID-19, a practical approach. I think we would all agree that COVID-19 has had a huge impact on all our lives as it continues to spread across the world and is even resurging in many countries. And whilst there is a clear and urgent need to tackle COVID, it's essential that diseases such as malaria are not ignored. As a community, we must remain committed to supporting the prevention of malaria, but also ensuring a safe environment for all, including workers on the front line, homeowners, and all that those that we come into contact with. And today's event will hopefully give us some clear and practical insights on how we can continue to deliver vector control and IRS in particular in these challenging times. And before we get into today's agenda, I would just like to touch on some webinar etiquette. Can we get the next slide, please, Lindsay? So some ground rules here. So all attendees are in mute and their camera is off on the off setting. If you have any questions, please write them in the Q&A panel, and these will be addressed at the end of the webinar if we have time, or in written form at a later date. If there are any technical issues that you may have in accessing the sound or visuals, please write them in the chat panel and these will be addressed. And lastly, this webinar is being recorded for later publication. So let's move on to today's exciting agenda. So firstly, we will get insights from Dr. Chadwick Sakala on E8 malaria upsurges and the impact of COVID-19. We'll then hear from Inigo Garmendia on the latest application innovations. Dr. David Zingari will give an overview of important safety measures for IRS sprayers. Then Francois Martins from Goodbye Malaria will give his experiences in new IRS training under the current COVID regime. Lastly, we will hear from Jenam Jacobs of PMI VectorLink about spraying during the pandemic. Hopefully, we will also have time for Q&A at the end of this and an open discussion. So, without further ado, I would like to introduce Dr. Chadwick Sakala. Chadwick has over 14 years experience in vector control and entomological surveillance at national and regional levels. He is currently working for SADC Malaria Elimination 8 Secretariat as Head of Technical Support and Operational Research. I'll hand over to you now. Thank you, Dr. Sakala.
Thank you very much, moderator. As mentioned, my name is Chadwick Sakala, and I'm basically going to give an overview of the malaria upsurge in the E8 region, SADC, and also talk about some of the things that the Secretariat, working with a partnership, has put in place to ensure that we still maintain malaria as high on the agenda, even in the face of COVID-19. Next slide, please. Thank you. So this is exactly what I mentioned. I'll just talk about what the E8 is and then delve into the middle of my presentation. We can move on to the next slide, please. Just to give an overview, we are all aware of what the E8 stands for, and it's a ministerial initiative who came together to say one country can't eliminate malaria without the neighboring country being able to foster and put our efforts together. And basically the vision is to have a malaria-free Southern Africa. And the goal has been that by the year 2030, all the 8 countries should have been able to eliminate malaria through a collaborative platform, which is basically the E8 Secretariat. And as you maybe know that we have countries that are in green, which basically have managed to reduce malaria to a certain level that elimination was expected that by 2020 they would have eliminated. Then the other ones up there, which are more high burdened, expectations was that by 2030, but suffice to say that the target still remains the same. Hopefully that by 2030 we would have moved miles into eliminating malaria in the region but also to mention that it thrives on the 4 main objectives, which basically talks about regional coordination. How do we coordinate all our efforts as a region to ensure that we are able to reach our targets, which is 2030, having achieved zero transmission in the Secretariat or in the E8 region, so to say. And also just to ensure that we continue advocating for malaria to be high on the agenda on our leadership. We've got a ministerial conference or council that always speaks to malaria, and this is always elevated to the presidential hierarchy to ensure that these efforts are also supported by the leadership within the region. And also the third part is just to ensure that the knowledge that we have within the region and beyond is harnessed to ensure that programs are able to use this knowledge to ensure that policies are harmony. What is happening in the neighboring country should be able to harmonize with the neighboring country to ensure that we do not have disparities in how we are deploying our intervention. And this speaks to the issue that I mentioned about coordination. And also to engage, as you know, one country can't eliminate malaria without the other country, the bordering country working together. So we facilitate these cross-border initiatives to ensure that countries are speaking the same language. Countries are using effective control measures to ensure that we also are moving towards the same goal. And of course, to do this, you need resources. You need to ensure that you sustain what you've already raised and what you envision for you to move the agenda forward. You need resources. This does not just mean funds, but it also means the human capacity within the region will be able to support and provide the technical know-how that is required to sustain the efforts towards malaria elimination. Next slide, please. This slide basically just shows us, gives us an overview of exactly what has been happening in the region over the past 10 years, so to speak. So if you look on the left, you find that we have the frontline countries, and these are the countries that I mentioned in my earlier slide, that they have reduced malaria to a certain extent that elimination was envisioned that by 2020 they would have eliminated. But just suffice to say that if we look at this graph, one thing that comes to your mind that if we are talking about elimination now, Botswana appears to be one of the, appears to be the country that is close by. If we were to move step by step, one would easily pick up Botswana and Eswatini. Then when we move to the other side on the second line countries, these are the countries that are on the northern part of the frontline countries. I think suffice to say that if you look at all the countries, Angola, Mozambique, Zambia, and Zimbabwe, you would see that from this graph, Zimbabwe is one country that is moving closer to where the frontline countries are. And the rest, you may be aware, 2017, we had an upset and there's some plateauing, and you can see that some cases have been going up as we move forward. Next slide, please. This one is just to say, as I mentioned in my earlier slides, that this is a ministerial mandate and a clarion to call for regional elimination. Our focus mainly, as I mentioned in my earlier slide, is to look at the border areas, because without these borders controlling malaria, it simply shows that we are unable to eliminate malaria. So you can see, this simply just shows us from Q1 2020 and 2019, it simply shows how we've been progressing. So the colored border districts in green, these are districts that are showing reverse in transmission. So they were high, but because of the interventions that have been put in place, you could see that they've been performing quite well. Those from Q1 as comparing Q1 and Q20. The yellow one, these are without change. And as we move on, the red ones, that is where the concern is. So our aim is to ensure that all these districts from red, orange, yellow, they all turn green. And then we know that we are moving towards elimination. Next slide, please. What has been some of the responses that the region has put in place to ensure in the face of COVID-19? And this I'm speaking at the regional level. So a coordinated approach to this response was put in place once the cases of COVID-19 began to escalate in the region. So there is always bi-monthly calls that are coordinated by the Secretariat, where we have the epidemic prepared response focal points, persons from each country, where we share knowledge and best practices, and also try and help those countries where cases are going up, and we see how we can help them to ensure that with the partnership that we have around to help them be able to work around the problems that they may be facing as regards to malaria upsurge during this period. As I mentioned, we also have partner meetings where now we respond and we are able to engage and be able to see who can supplement or complement where there are gaps in the countries to ensure that we do not leave the malaria agenda behind due to the COVID outbreak. And in the face of COVID epidemic, we still continue to advocating to the countries to prioritize malaria supplies. As you may be aware, there's been some, I think, shortages of some commodities because most of the focus now has been towards COVID-19, and we're still advocating at the highest level to ensure that manufacturers or companies across the world that are producing malaria commodities still continue to produce those commodities in spite of the COVID-19, and that has been done mostly at a much higher level. And we're also helping out with the emergency procurement of malaria commodities where we can, working with our partnerships, trying to identify what sort of gaps countries have, and then we try and see, working with the partnership on how we help countries to ensure that procurement of commodities continue flowing within the region. And also just to mention that through the Global Fund support, we've been able to apply and be able to identify some of the gaps that the countries have. And through the Secretariat, we've also applied, whilst countries themselves have applied independently for the COVID-19 emergency funds, we've also come in to try and help and bridge the gaps that might be able to meet the regional aspirations as towards malaria elimination. And the last slide, please. So what are some of the proposed things that we've come up as we are moving towards the this coming to transmission period? Commodity forecasting and quantification for early procurement. This is very important, and we've working with countries to ensure that all the commodities are in place and we're able to track where the commodities are and be able to talk and discuss with those that are involved in the procurement system to ensure that we have the products that are needed in country as early as possible. And also just to ensure and re-emphasize with the countries that they need to reinvest and sustain the malaria resources even during the COVID. We know that resources are being diverted to COVID-19, but we've been emphasizing, and countries have been well involved in this to ensure that the malaria funds are reinvested so that we do not solve one problem and we leave one issue. The plans are there. Countries have come up with resilient plans post-COVID, and also advocating for increased domestic allocations for malaria so that we do not lose traction of what we've already gained as regards to malaria elimination. And also strengthened partnership in ensuring that all the supplies within the region and all the issues that are required for us to continue supporting countries cohesively to move towards elimination are all put in place. And we've also started a senior meeting of our officials within the government who are policymakers to link them to the technical and operational elements so that the two are speaking together to ensure that the technical people and the operational people or human resource at that level are supported by the policymakers to ensure that they have the resources and the support they need for them to continue moving the malaria elimination agenda amidst the COVID-19 pandemic. Thank you very much. I think that's the end of my slide.
Thank you, Chadwick, for sharing the gains and the very, very sound proposed solutions for the forthcoming transmission season. Next up, we have a session on innovation in IRS from GOISPA presented by Inigo Garmendia. Inigo is the Public Health Product Manager of the GOISPA Group, in charge of research, development and marketing of new spraying solutions to fight vector-borne diseases such as malaria, Ebola and cholera. Before leaving the Public Health Department, Inigo spent 15 years as an engineer developing new efficient ways of spraying for different fields such as agriculture, industrial and public health. Welcome, Inigo.
Thank you very much, moderator. Good afternoon, everybody. I'm Inigo Garmendia, the Public Health Product Manager of IRS Spraying, and it's a great pleasure to be with all of you. And I would like to thank the organizers for giving me this opportunity of doing this presentation regarding innovation in IRS spraying. I would like to start this presentation letting you know that approximately 2 years ago, two important companies of the sector, Micron and GOISPA, joined their forces, experiences and knowledge, and now we are together in the same group, GOISPA Group, with the aim to continue offering to the market better products and services through innovative solutions. We are trying that. So today I would like to briefly present our current solutions for IRS and new product developments to address traditional IRS challenges. So let's start with innovation in standard stainless steel sprayers. And Micron developed the CS10 and CS14 stainless steel compression sprayers to address one of the most important objectives in any IRS campaign, that is efficiency. Please, next slide. For that purpose, this sprayer comes equipped as a standard with a ceramic even fan nozzle. This hard-wearing material avoids erosion to a great extent, and the nozzle lasts from 5 to 10 times longer than traditional hardened stainless steel nozzles, especially when waterable powder chemicals are used. Also, another important tool that is equipped this sprayer is a control flow valve that keeps automatically the spraying pressure at the nozzle constant, despite the important pressure variation inside the tank. So, liquid volume emitted is always constant. I would like also to mention that sprayers suffers an intensive use in the field, and in order to improve their robustness, almost all parts of this sprayer are made of stainless steel materials, including the pump cylinder, to avoid corrosion and stress fracture. Next slide, please. But recently, GOISPA has developed the first non-metallic equipment that meets the most recent HOOPS specifications, the IK Vector Control Super Compression Sprayer. This is a new sprayer especially designed for vector control and larviciding, using the most advanced materials and processes, and based in our large research and experience observing field operations. So, next slide, please. So these are the most important benefits of this new equipment. First of all, again, efficiency. This is one of the most efficient sprayers of the market because it comes also equipped with an unique low pressure control flow valve that keeps the spraying flow rate constant. Also, it comes equipped with polyacetal high quality nozzles, especially designed that makes them last longer than any other traditional hardened stainless steel nozzles. But probably one of the most attractive features for spray operators is the lightness, okay? This sprayer is very light, less than 3 kilos, and it's very easy and comfortable to carry on the back. So the fatigue of spray operators in long working days is very much reduced. Another important aspect when they are operating in the field is something to be easy, okay? This sprayer has been designed especially to be easy to use, easy to assemble, easy to clean, easy to maintain, especially reducing the number of components of the sprayer and designing them in the most appropriate way. So one of the important things here is to become easy. So next slide, please. Some other unique features of this sprayer are a tank that is translucent for easy volume reading, a footrest that is integrated in the tank, so pumping is more stable and easy. It is equipped with a unique feature that is the nozzle protector that avoids clogging or damaging the nozzle from outside dirt. Also a filling filter that avoids dirtiness to go inside the tank when we are doing the filling. And also it has a very special lid that you can use it to store the spare nozzles and filters that are coming with your standard equipment. This equipment comes with 2 extra even fan nozzles, with 2 extra solid stream larvicidal nozzles and 1 extra nozzle filter. And we are providing this kind of spares because sometimes these small things can be lost during cleaning or during the field operations. So all these unique features makes IRS experience very different, more efficient, less fatigue, safer and easier. And we really think that these are important benefits in these challenging times of COVID-19. I have to say that this spray is already being extensively used in many African IRS campaigns for the last 5 years with very high customer satisfaction, thanks to the product quality, but also thanks to the after-sales service. Next slide, please. But we continue thinking how to improve even more current IRS spraying. We realized that even having the best equipment, efficiency, the position of the correct insecticide dosage on the walls, very much depends on operators' spraying skills and supervision. So is it easy to train operators every year correctly to acquire the correct spraying technique, distance and speed? Is it easy for operators to spray correctly in the field under sometimes difficult spraying conditions like darkness, obstacles? Is it easy to do a good supervision of the daily job done by operators in the field? And most of the time, the answer is no. It's not easy because we don't have good tools to train operators, to guide them and help them in the field. And also we don't have good tools to supervise them. So next slide, please. So GOISPER and IBCC together decided to start this project called IK SmartLight. The goal is to develop a new device to improve IRS application spraying quality and effectiveness by making easier to train operators, easier to guide them in the field, easier to supervise them daily in their job. So this new device will be equipped with color lights to help applicator control spraying distance easily. If they see the green color, it means that they are spraying at the correct distance. If they see blue, they are too close. If they see red, they are too far. It also comes equipped with an electronic beeper that sounds every second to help applicators timing. Also with a LED spotlight to illuminate dark rooms and with a rechargeable battery. It also will come with a flow meter to measure the amount of job daily done by an operator, spraying hours, amount of chemical sprayed, and also a smartphone app to visualize and supervise the spraying quality easily. Next slide, please. So the results that we have obtained in preliminary prototypes tests done in the field have been quite encouraging, because we have seen that all operators improve significantly their spraying quality in just few days and very easily. And now we are in the last stages of the final design, trying to integrate all the improvements and learnings from the field. And we hope to start the final validation test in the field very soon. Next slide, please. So a key message here is that to successfully innovate is not an easy task. It requires dedication and investment, but our aim and commitment is to let's continue moving, improving, innovating to make things happen. So thank you. Thank you for your attention.
Thank you, Inigo. I would now like to introduce Dr. David Zingari. David has been involved in malaria vector control for well over 30 years, working in both the private and public sectors. He has been instrumental in championing a number of vector control initiatives across sub-Saharan Africa, alongside organisations such as WHO, FAO, and various USA-funded programs. Welcome, David.
Thank you very much, and greetings to all the participants. Next slide, please. My subject this afternoon is or today, for some it's early morning, for some it's later in the evening. So I'll just say today, is to deal with the safety issues concerning vector control during this particular pandemic period. And my first question the question that I posed initially is, what are our challenges? We have usual challenges that we've gotten used to: purely burden of the malaria, the drug and insecticide resistance, low coverage of recommended intervention strategies. We've heard just the previous presentation highlighting on that as well. Scarcity of a reliable, effective vaccine, and weak or resource-constrained public health systems. And that last point will feature again when we look at the new challenges. And the new challenges are basically all the old challenges, but now exacerbated by the new challenge of the COVID pandemic. And in the COVID pandemic, the challenges that we face, particularly linked to the COVID, are that there's general fear of getting infection, both from the householder that we're intending to protect and from the operator that is doing the job. So there are operational safety logistics that are posed by this new normal, and those we will go through as well. We also have the challenge of resource competition. Like I said, we've got weak or resource-constrained public health systems, but however, those weak resources are now being competed for in the face of the COVID pandemic. We also have operational acceptance of malaria control programs, because some people will now start to think, will I let these people into my home? Do they not have any infection? All those kind of questions will come up. Operational misconceptions. There's a lot of social media that goes around and talks about different issues related to COVID. And some of those issues are being linked to malaria, particularly when it comes to treatment and so on. So there are so many issues that we will be dealing with and challenges that we are facing in this new pandemic. Next slide, please. So in order for us to look at the critical areas, I've highlighted a circle which I've borrowed from a technical working group meeting that I also attend to in Zambia. In this chart, I've highlighted specific areas that we are going to talk about in order to isolate areas that I think will be of importance during this pandemic area. And these critical areas are having meetings, training, transportation, and the actual implementation of our vector control programs. Next slide, please. So if we look at those critical areas, I'll start with the issue of safety during meetings, trainings, and field operational activities. I've grouped those three together. We find that our biggest challenges are toward meetings. First of all, planning meetings. We now need to relook at how we do how we operate. Basically, all our appropriate meeting venues have to be well ventilated, they have to be pre and post sanitized. All our participants have to wear face masks. All our facilitators, in addition to wearing face masks, we are encouraging that they also wear face visors because they are interacting with all the delegates within a room. We also have a limitation in the number of people in that room. But as they enter the room, we are encouraging that they go through a foot bath, they wear appropriate, they wash their hands appropriately. And so appropriate hand washing facilities have to be provided in all venues, and temperatures have to be checked for all participants before they enter to make sure that their temperatures are within the range that is allowed to visit any meeting rooms. And then we also need to maintain a daily register. These are some of the things that we never used to look at seriously, but now they have to be looked at. The daily register is to do with if there is a case that does okay, at least there will be easier contact tracing. So next slide, please. And then when we look at the pre-season training programs, we also look at the old normal. If you look at that picture that I've posted there on the first column, it shows the old normal, where trainers would not necessarily have to wear their full PPE. But now trainers have to wear the full PPE as well, just like the trainees, so that at least no transmission of the COVID happens either from the trainer or from the trainees. So all involved have to wear full PPE. And then we need to provide hand washing facilities or hand washing stations, as many as possible at all possible sites within the training venue. We also recommend, again, a maximum of 15 SOPs per each session, if possible, to minimize crowding within the training session. So we're also looking at 15 SOPs or spray operators in terms of teams as well. I'll reiterate this point again in a later slide. And then redesigning our transport vehicles appropriately to fit the reduced numbers. This is to do with social distancing. Our old system, some vehicles would carry as much as 40 or 50 people, or in some cases even up to 60 people. But in the new normal, this has to be relooked at, and appropriate measures have to be put in place to redesign appropriate transport. So we have to minimize long distance-based personnel recruitment as well, in line with that. And this will also reduce the challenges of program acceptability. Because if you are recruiting locally, the tendency is local people know their own, and they'll be confident that their own may not be infected. So again, we also looking at the issue of considering community-based strategic initiatives, and I'll highlight this again in the next slides. Next slide, please. So when we look at other core implementation activities, we look at combining both the indoor residual spraying and the net distribution, because those two programs augur well for vector control initiatives. So we're looking at all operatives must wear full PPE, like I indicated earlier on, provide personnel, all of them, with personal hand sanitizer bottles. Our spray operators need to be moving around with at least a small hand sanitizer, which they can use as they leave one household. Before they enter another household, they are using their hand sanitizers, which they carry with them. This is because as they do their operations, you find that they handle a lot of materials, and you wouldn't want your spray operators either to be infected or the spray operator to leave infection in their clients' households. We all know that they do wear protective gloves, but those gloves are not washed between households. So we need to make sure that we are sanitizing ourselves as much as possible in all the interactions that we carry out. So I reiterate the point of reducing the team sizes, maintaining social distancing, implement strategies for last mile operational activities. And these are activities related to your mop-ups and activities related to hard to reach places, activities related to some critical areas that one may need to look at. And in this particular case, we are asking programs to consider use of motorcycles, bicycles, or smaller carrying capacity vehicles for those last mile activities. We also encouraging that spray operators, where they're using bicycles, you're also assisting in those last mile activities. And I pose a picture there from Uganda, where such programs have already started happening, and they have a bit more experience in that already. Consider community-based IRS, I reiterate that message again, and all field operatives to observe COVID-19 safety recommendations, particularly maintaining social distancing, wearing their masks properly, and sanitizing their hands as recommended. Next slide, please. Thank you very much.
Thank you, David. Very nice overview outlining the additional complexities as we deal with COVID. Our next presentation is from Francois Martins. Francois has over 20 years' experience in applied malaria research and vector control. He started his career at the South African Medical Research Council in 1999, where he was immediately seconded to the Lubobo Spatial Development Initiative Malaria Control Program in Mozambique. In 2007, Francois joined Africa Fighting Malaria, where he conducted malaria research with a focus on IRS. He later joined Newfields as the vector control manager, overseeing all vector control activities at the workplace and at the community level for mining companies across Africa. More recently, Francois established his own malaria control consultancy, IMCC, and he is currently the co-CEO of the LSDI2 program. Welcome, Francois.
Thank you very much, Andy. Good afternoon, everybody. And thanks for the opportunity. Our presentation will be based on our context and our experience so far in preparation for this year's IRS spray rounds in Mozambique. We're focusing on 3 provinces, Maputo, Gaza and Inhambane provinces, and we're spraying 18 districts using just under 1,500 spray operators. So I hope that our presentation will assist some of the implementers this year. Thank you. Just next slide, please. As we all know, the current COVID pandemic has caused disruptions to disease control programs in general. The peak of the COVID pandemic is expected to coincide with the malaria transmission in some of the Southern African countries, which is of great concern. And it's even more reason to stick to the plans this year. It's critical that African countries protect their gains made in malaria control by ensuring that the planned IRS and BedNet programs continue. The current COVID-19 pandemic has made the planning and preparation for malaria control slower and much more complicated, and it requires a practical and flexible approach to adapt to changing conditions on the ground. Next slide, please. Like all spray rounds, the pre-intervention planning is really important, and advanced IRS planning this year is crucial because there are several delays that you've got to deal with, especially when it comes to borders, especially when it comes to shortages of PPE, and we've experienced this so far this year. It's really critical that programs place their orders well in advance this year, much sooner than normal, to ensure that everything is in place before, for the various vector control interventions. IRS planning needs to be aligned with the COVID regulations, and unfortunately, there's no one size fits all here. You've got to look at your country where you operate in and look at what the government prescribes to you when it comes to COVID regulations. But you need a SOP for all training venues because if you can't do IRS safely, then that's a real problem. You could actually make the COVID problem in these countries much worse. Next slide, please. COVID-19 regulations, limit the interprovincial and inter-district travel, which makes training really, complicated, especially if you're used to using training centers. So the decentralization of IRS training is required, for you to train all the spray operators that you need to in time for the spraying. In our case, we're training at every single district at least 3 venues, and we're using our storage facilities and wash facilities, as they provide you 2 out of the 3 aspects that you need. There's running water, there's solutions, and we made a plan for spray walls, which I'll show you in a slide soon. Each training venue requires COVID-19 stations where you need to take the temperatures of the spray operators and where everything is recorded. We introduced a system whereby district managers become the COVID officer, and he makes sure that all the COVID regulations are adhered to and implemented at all the training venues. Next slide, please. So these next pictures are basically just some of the measures we're taking currently as we're busy doing the training as we speak. So there's social distancing on the left-hand side, obviously temperatures, and we disinfect the vehicles coming in and out of the areas as well. Next slide, please. The mobile walls on our side is probably the biggest innovation that's changed this year. We worked with a company in Johannesburg that specializes in the building of stages to come up with a mobile solution for us. So every single district at multiple venues have these walls. It's quite easy to set up, and essentially every training center venue now has 60 linear meters that they can use for the training because we can't use the traditional training centers. Next slide, please. The IEC is going to be crucial this year. It's going to be a critical component to ensure that it covers not only your vector control messaging, but your COVID messaging. All IEC messaging material, and especially visuals, need to be adapted, to include COVID. And on the next slide, you'll see some of the examples. Next slide, please. So, these are just some examples of pamphlets and posters that we had to redesign. You'll see the visuals on the posters are really important because, people wearing masks, people social distancing. I think, this is going to be really critical to get access to people's houses, especially in a COVID situation where people tend to be quite hesitant of other people. So it's really important that your IEC material speaks to that. Next slide, please. So, thank you. So on the IRS side, protecting the spray operators, team leaders, field officers, district managers, and provincial managers during COVID is going to be one of the main priorities for us specifically. If we look at our team, the most experienced people are the older people, and we can't afford for them to get sick during a spray run because they coordinate the entire operation. So what we're planning to do is we're going to do age profiling of staff. People over the age of 60 or people with comorbidities will be kept from the front line. If staff members come down with any COVID-related symptoms, they will self-isolate to prevent further spread of COVID in the spray teams. And obviously, the transportation of spray operators needs a rethink. We won't be able to transport spray operators the way we used to. So that's just a few of the many challenges that we're dealing with this year. I hope some of the stuff that we raised in the presentation is helpful, and I'd like to just wish everybody good luck for this coming spray round. Thank you.
Thank you, Francois. Our final session on spraying during the pandemic is from Janam Jacob. Janam is a technical program manager on the PMI VectorLink project implemented by Abt Associates. She is responsible for the day-to-day management of the Burkina Faso, Benin and Madagascar programs. She also works as the project director on the Malaria Zero Haiti IRS project. She is based at the Abt headquarters in the United States, and we're very lucky that she's found time to join us today. So over to you, Janam.
Thank you very much, Andy. Good morning and good afternoon to everyone, depending on where you are. So I will be presenting on VectorLink spraying during the pandemic. Next slide, please. So as a brief background on the project, the PMI Vector Link is a 5-year project that is funded by the United States Agency for International Development, so USAID, through the President Malaria Initiative, PMI. The project currently works in 24 countries in Sub-Saharan Africa, as well as Cambodia and Latin America. The main goal of the project is to equip countries to be able to plan and implement integrated vector control that includes a safe and cost-effective implementation of indoor residual spray activities, also entomological monitoring activities, and also providing support for the deployment of insecticide-treated nets. During the COVID-19 pandemic specifically, during the lockdown, VectorLink continued its activities, including the planning and the implementation of IRS in 8 countries. That includes Benin, Burkina Faso, Mali, Senegal, Ethiopia, Uganda, Tanzania, and Ghana, where they actually completed the spray campaigns. And the project is also in the planning phase for some of the upcoming spray campaigns in other countries. The implementation of IRS activities is made possible through the procurement and the use of 3 main insecticides that are used, of course, to spray the walls and the structures. And those insecticides include organophosphates, specifically Actelic, neonicotinoid, specifically SumiShield, and clothianidin and deltametrin combination, Fluorofusion. So all these 3 insecticides are procured respectively through Syngenta for Actelic, Sumitomo for SumiShield, and Fluorofusion under Bayer. Next slide, please. It is also important to note that the implementation of spray activities require very close coordination with in-country stakeholders in general. And so during the pandemic, the project continued to receive dedicated support from in-country stakeholders that include government officials, the administrative and health authorities, as well as local leaders within the communities that were there to help us address any questions, concerns, and challenges that the team faced in the field. In addition, the PMI team and other in-country partners were key in supporting the project. So because physical contact or in-person meetings were not possible at the time because of the pandemic or very limited, the project made sure to continue the planning and implementation of its activities. And so we came up with remote meetings. So we had a lot of virtual meetings with the in-country stakeholders where we had the planning meetings, but also trainings. And some of these trainings include TOTs, which is training of trainers, micro-planning, advocacy meetings through some of the technological tools such as Zoom, WebEx, Google Hangout, WhatsApp, whichever tool worked well in a specific country that we were implementing the IRS campaigns. In addition, the project teams, in close coordination again with the in-country stakeholders, develop a risk management plan that is based on WHO guidelines and that included very detailed mitigation measures that we were putting in place to be able to safely implement spray activities while protecting not only the spray teams, but also the beneficiaries that we were trying to protect. The government officials were very involved. They were very active in the supervision of the spray campaign activities as well from the national and the district level, where they also provided support in making sure that these mitigation measures that we had put in place were also reinforced in the field. Next slide, please. And so specifically, some of the actions that we put in place during the trainings were making sure that the trainings took place in rooms that were very well ventilated with a very limited number of participants, so very small groups, or outdoors in some cases. And whenever technology allowed, we also held some of these trainings virtually. So whether the trainings were held indoors or outdoors, social distancing was key. And so we require of each participant to be between 1 and 2 meters distance, to have that distance between themselves to avoid any risk of contamination. And also at each of the operation sites that we operated off of, we installed hand washing stations that had soap and water for all of the participants to use. So every participant before entering the training room would have to wash their hands properly with soap and water. And of course, wearing masks was mandatory at all times. All of the spray actors, the spray teams wore masks at all times, including the other personnel as well. Next slide, please. So during the spray activities implementation phase itself, the project continued to reinforce community education and sensitization campaigns, messaging that included preventive messages related to malaria and COVID. And so it was very important for the project to ensure that the beneficiaries, the communities, understood the seriousness of COVID while we were also implementing malaria activities. Now, at the operation site level, before the seasonal workers or the workers, the spray team started working or interacting with others, we made sure that the temperature was checked every single morning. And also, there was a regular disinfection of vehicles that were used to transport the spray teams from the operation site to the spray areas and back to the spray areas at the end of the back to the operation site at the end of the day. In addition, the restrooms and the changing rooms that were used by the spray team or the personnel in general were also very deep cleaned. Warehouses that stored the project materials were also cleaned with bleach. Social distancing was a key requirement between all of the spray team members, the personnel, but also with the beneficiaries. So the spray teams were required to have a safe distance between themselves and the beneficiaries that we, again, were trying to protect. During the transport of the spray teams from the operation site to the spray areas, the spray teams wore full PPEs, so including their masks, their helmets, their full combination, the gloves, boots, etc. So everything was fully on those spray operators to be able to minimize, again, contamination in those vehicles. So the same mitigation measures applied also to the entomological monitoring teams. They were all required to wear masks, to carry hand sanitizers with them, but also disinfecting supplies. In addition to those, they carried with them storage materials to be able to collect all of the waste that they generated in the field. Next slide, please. So the end of the day cleanup is, again, one of the phases of the spray campaign where at the end of the day, all of the spray teams will actually come back to the operation site after a day of spraying. They would be responsible for cleaning their materials, their equipment, getting changed, handing over their forms, and then heading home. And so during that time, there is a risk of crowding at the site level. If, for example, you have over 20 spray teams at one operation site, so those mitigations measures that the project put in place included a staggered arrival of spray teams. So it would be only one spray team lining up, again, having social distancing of about 2 meters or 1 meter between themselves. And it would be one group of spray team in general, about six people at a time that would go and hand over the equipment at the wash area. And so normally, what the project did was to have the spray operators clean their own materials at the end of the day. But again, to avoid overcrowding or crowding out at the wash area, so the tasks were split. And so pump technicians that are in charge normally of repairing spray pumps were assigned to clean the spray equipment. So that included sprayers, face shields, the helmets, etc. And so they would take all of these equipment from one person at a time, from one spray operator at a time. In addition, the washers that are assigned to wash all of the combinations of the coveralls for the spray operators were assigned to clean the boots, the gloves, and the coverall. And so that really, that partition of task, that separation of task allowed the spray teams to spend less time at the operations site level. And so the handover was very quick. The spray teams will hand everything over very quickly and then go and clean themselves and leave. Now, to also avoid contact with the storekeepers. So the handover of all of the insecticide sachets or insecticide bottles, and also the spray forms, those were handled directly by the team leaders at each of these operation sites. And so that reduced the contact that the storekeepers had. Again, the wash area was deep cleaned at the end of the day. And all of these, the areas that the spray teams or the personnel use were deep cleaned with bleach in general. And so this is the end of the presentation. Thank you all so much for your attention.
That's great. Thank you, Janam. And thanks to all the presenters today. And for me, it's great to see that these programs can continue to deliver IRS efficiently, but also very safely for all those involved. So congratulations to you all. We have a couple of minutes to answer the questions. We have, I think the first question that came in is for Chadwick. And this is from Victor Hadona, who's asked, if you say eliminating malaria, do you mean mosquitoes that infest malaria would be neutralized? If so, by what means? Chadwick, do you have any comment on that?
Yes, I do. Thank you very much. I think it's very important to understand that when we talk about malaria elimination, we are talking about eliminating the parasite itself that transmits malaria. The vector, the mosquito, is just a transmitter that moves one parasite from one area to the other. And all these measures that my colleagues have been talking about, IRS, is just to ensure that we halt that transmission. If a mosquito, a vector has a parasite in it, IRS works to ensure that we suppress the population of the vectors. In doing that, we are also suppressing the population of the parasites in the communities to ensure that we're able to transmit or disrupt the transmission of malaria. Thank you. That's just to summarize it in a nutshell.
Thank you, Chadwick. And we've had a couple of questions around, can we share the presentations? I think we'll work with all the presenters to try and share as much as we can and send those out to you. And as I say, we also have the event recorded and we'll see if we can share that as well. So thank you for that. We have a question from John Clayton. I'm interested to learn from Francois what disinfectant products and methods are being used, such as sprays and fogs, to disinfect vehicles and other materials in use for COVID-19 transmission by IRS spray teams.
Thanks for the question, John. We're using a bleach solution, and the application equipment is basically the same spray pumps we're using. We're using AW2E nozzle to get the smallest possible droplet size out, to spray the vehicles and other surfaces.
Thanks, Francois. We have another question coming to Janam. Did any of the countries who have finished their spraying report an operator positive for COVID-19?
Thank you for the question. From all of the spray campaigns that we recently completed, no, we were not made aware of any positive cases within the spray teams.
Great, that's really good news. Questions are coming in. We have quite a few questions now. So we have one from Michael McDonald. Ethiopia is using community-based health extension workers supervising IRS operations. Do you see a day where communities themselves can conduct spray operations with improved spray equipment rather than rely on outsiders? This is a question to PMI. Janam, do you have an answer?
Apologies, I'm reading the question to make sure it is, I understand it well.
Oh, yeah.
So this is a very, very good question. Yes, these are, of course, these are ideas that are still being discussed. Of course, we try to make sure that we work within the communities, that the recruitment is actually made within the communities themselves, to just facilitate the spray campaigns themselves. However, having beneficiaries or others living within the community do the spray campaigns themselves, it's something that that has not yet been decided or fully, yes, there hasn't been any full decision on that. But again, spray operations, we try to again work with the community members as far as recruitment goes, and also in terms of to facilitate the logistical aspects.
Great, thank you. We have another question around how is social distancing being managed in vehicles during IRS, and what is the recommended space between sprayer operators?
Thank you, great question. So we use a number of different vehicles during the spray campaign. Sometimes we have these large buses or small minibuses, depending again on the availability or the type of vehicles that are available in the districts that we spray in. And so normally we would go with about 1 meter, but the requirement of because of the tight space in the vehicle, but the requirement for all of the spray operators that are sitting in the vehicles is to wear full PPE, again, to minimize the risk of contamination.
Thank you, Jan. We have a question regarding how will budgets be reviewed by the sponsors to cater for the extra spending requirements for the purchase of PPE and other protective measures? Very interesting question. Anyone on the panel prepared to comment?
And in our case, we applied for additional funding through the Global Fund mechanism, to cater for all the additional PPE that you would use during COVID, which you wouldn't normally use. So the typical things is hand sanitizers, wash stations, thermometers. So, so it's quite easy to manage because it came from a separate budget in our case, at least.
Okay, great. Thanks, Francois. Question from Tara Seitala. And this one's for Inigo. Thank you so much for the presentation. Assuming IK Smart would just be used during training, could you share whether the improved spray quality from using IK Smart are sustained throughout the spray season? i.e. does using IK Smart during training have a lasting effect on spray quality? Over to you, Inigo.
Thank you very much for the very good question. Using the IK Smart Light in trainings helps a lot acquiring a good spraying technique and skills because they are learning how to follow the lights. Now, the reference is not the distances, the reference are the lights of the IK Smart Light. And it's quite easy to follow the lights. The thing is that then when they go to the field, if they don't have the IK Smart Light with them, probably they are going to lose much of the learnings that they had in the training because they don't have that lights reference. So in my opinion, probably the spraying skills and technique will not last too much. Just an opinion.
Thanks, Inigo. We have another question here. In the current context, with the increased mistrust from the local population, have you faced refusal from some of the targeted communities? Very good question.
Thank you for the question. So we as with any campaign, there is a number of refusal cases within the communities that we spray in. So, however, we have not really experienced refusal cases based on the pandemic or the COVID situation itself. most of these refusal cases were based on, of course, some of the houses being completely locked, and there isn't an adult inside to be able to allow the spray teams to go in and spray. Again, also some people who are generally sick and can't leave a room or their house. In those cases, we cannot spray. Or some of these structures that have turned into greeneries, for example, food storage. So when we get in, we normally would not spray those rooms. So we had cases of refusals within the targeted communities, but not really related to COVID itself. And I think also the one very important aspect to note is that the project did a lot of sensitization within those communities in regards to COVID prior to spraying. So that was also very helpful in minimizing the refusal cases.
Mm-hmm. Thank you. And another question very much linked to that is, recruitment of spray operators is one of the important components of IRS. Do you do rapid testing of the of COVID-19 before their engagement? And I think that's probably a relevant question for the number of the programs going on today.
David, in our case, we had discussions with the government, and they said we shouldn't, simply because there's not enough rapid tests available. So they felt that the diagnostics were better used in the health facilities as opposed to in the malaria control program as such. But I think we're doing all the temperature measurements and looking for symptoms and all that stuff.
Is that a similar approach with the PMI programs, Jenna?
That is correct. That is correct. So taking the temperature and just going through the list of health check, the criteria for making sure that the spray operators were generally well and healthy before they start their day was what we did on the PMI vector link project.
And David, any views from Zimbabwe?
Well, from my point of my perspective, I think if resources are permitting, it would be nice to have those RDT tests at recruitment level. But however, that's no guarantee that they will not get infected when they go back to or they meet other people. So I think as a general rule, continuous monitoring would be necessary on a daily basis, checking temperatures and doing all the other necessary checks that pertain to COVID-19. So if resources permitting, yes, but if resources are not permitting, I wouldn't see it as a hard and fast rule at this stage, because most countries, I think, are facing challenges of resources to mobilize sufficient resources to carry out all their programs, both COVID and malaria at the same time.
Great, thanks, David. And we have another great question here. Did any of the countries undertake virtual training of trainers? If so, could you speak more on how effective this was and how the practical sessions would be handled? And I think that's a question for Janan.
Yes, thank you. Great question. So if you look at the one of the slides that I presented, there was one picture of a virtual training that we had with all actors that were involved in the planning and the implementation of the spray campaigns in one of the countries that we work in. And so because of the video features that we have, the possibility to share the screens where you could make presentations on the specific trainings, that was very helpful. And so the participation was very active, interactive. People would ask questions. The presenter would be presenting on every single aspect of the training itself, and all done virtually. So that we didn't have any major challenges in terms of that. Sometimes you will have over 30, 40 participants in one of the trainings. So in general, the trainers were able to, again, show their slides, speak. You could see them on video. Participants could also be seen on video as well. So participation was great, and there was also opportunity to ask questions and get answers right there.
Great, thank you, Janan. We have another question, and this is for all of the panel. Are you aware of any plans to monitor and document the impact of COVID-19 on malaria?
From my perspective, I think this would be a great idea because I think already we are anticipating challenges in the upcoming malaria control programs due to the COVID. So I think it would be where programs have the resources. I think these are areas where various programs could get together and come up with some protocols to see if this can be monitored, particularly if multilateral technical partners such as WHO could come up with some coordinated protocols, because I think this needs to be a coordinated activity amongst the regional countries in particular. Rather than doing it as an individual country on its own, I think it needs to be coordinated regionally as well.
Yeah, I agree, David. I think WHO will come in really handy on that. But I think the stats will tell the tale. But I think to what extent COVID is going to have an impact on malaria and is to a big extent in our own hands. And that's why it's important for us to stick to the vector control plans as far as possible.
Yeah,
if there's not going to be any vector control, then obviously COVID's going to have a bigger impact on malaria. And if we stick to the plans as far as we can, then hopefully we will minimize the impact.
Yeah, very good point. Another question related to funding, and hopefully not the changing of funding to different areas, is with the dwindling government resources in healthcare delivery, what other source of funding do we expect in the near future? Interesting question there.
Look, I think funding should be a concern of everybody. I think if you look at geopolitics at the moment, big funders like the Global Fund and the other funders are unsure of who's going to contribute going forward. I think one of the solutions for alternative funding is maybe the private sector going forward. I think our own program is a very good example of that. It's a public-private partnership. And it's the private sector working together with the Global Fund. So I think that could be a model going forward.
Thanks, Francois. Another very more technical question. What disinfectants were being used in the training venues, sleeping spaces, and ablution facilities?
So for the VectorLink project, we use chlorinated water with bleach to clean the training venues, and also a disinfecting spray again that has bleach in it. Hand sanitizer is available for the use of the team as well.
Thank you. And here's a very interesting question. What have we learned so far from the current COVID-19 pandemic? What are the mandatory activities and what are the activities which are less important, which could be deprioritized and reduce costs so that it could be relocated elsewhere?
I think from our side, I think unfortunately this year's spray run will always be more expensive than any other, considering the fact that you've got to have all the COVID regulations in place. Without the COVID regulations or without the COVID aspects, you cannot do IRS safely. So I think it's a big responsibility to have the COVID regulations in place before you attempt to do any vector control. But unfortunately, I think it will always be more expensive than a normal spray round.
A couple of questions here, probably rather linked actually. How do we communicate and make people aware that people with malaria or more are more vulnerable to COVID? And are we aware if there are any links between malaria and COVID deaths? I'm not aware of any link at the moment. I don't know if any of the panel are.
Maybe Andy, I can go back to the previous question that was raised, just to state that we can learn from this pandemic. If you look at the information system and structure, how information has been coming from COVID, I think the malaria community can learn a lot from the COVID epidemic, taking the positives, from this whole thing. I think it's been very impressive how information comes on a daily basis. And I think from the malaria perspective, that's a very good lesson to learn from on how we can also improve our information system to ensure that data is captured accurately, efficiently, and is being able to use to be able to implement our programs.
Great, thanks, Chadwick. So I think we've pretty much covered most of the questions. If we haven't, what we will do is review the questions and then provide an answer in written form, because we've just realised the time we've run over with all the enthusiastic questioning. So thank you very much for all the attendees, for all the questions. Thank you very much for all the panelists, for your presentations. It really was a great learning experience, I think, and it shows that together we can overcome the additional challenges of COVID and deliver safe, effective vector control for the foreseeable future, because I think, as many people are stating, it's now the new normal, and I think we have to adapt, and I can clearly see that the programs are adapting. So congratulations again, and thank you to all, and stay safe and healthy. Thank you.